We're going to assess your hip range of motion in both flexion, so bringing your knee toward your chest, and extension, kicking your leg back. Now, what happens a lot of the time is we think we have this really good hip flexion and extension, and maybe we do exercises. However, we don't notice that we're actually moving more through the low back. And when we don't have really adequate control of what's happening deep within this joint to get into flexion and extension, we might be doing just that, which is getting into the low back or compensating in other areas. And this could cause some low back issues. It could cause some knee issues when we don't have good focus on what's actually happening at this hip and good range of motion. Let's test it and see what's happening. We're going to test in 2 different positions for each of them. So in this first one, I'm going to be on my back here. Okay. Now, if you want to, you can lie on your bed if it's too difficult to really get down on the floor. However, just know that you do have a little bit of give on the floor. So for this test and this assessment, being on a hard surface is kind of nice. Now, one leg is going to be like glued down to the floor. So I want my opposite knee. I'm going to do my right knee right now, kind of glued down to the floor. Okay. The hips will stay stable. And what I'm going to do here is just try to bring my knee toward my chest as much as possible. Now, in this position, my hip bone will move a little bit. So I do get a little bit of pelvis movement. It's not like a pure range of motion test, but it's just an assessment to see where you're at. Now, if you feel like hip pinching in the front, we might not have good control of that joint in general. So there's a lot more than just hip flexion that we could do to start to relieve some of that pressure that's happening deeper into the joint. Okay. Those are more so gone through in the programs for the links that are located below. But let's just assess this. Sometimes setting out a camera is really nice, or you could just see testing side to side, like how much can my knee come up toward my chest? Ideally, what we're looking for, if you did have a camera or something on the side, is about 120 degrees. Now, this is just a rough estimate. Essentially, we want about a hand width from your knee to your chest. If it's a little bit more, then we probably have some restriction here. Okay. Test the other side. See if I again can get my hand about hand width from my knee toward my chest. Again, if it's a little bit limited or I feel some hip pinching or other things happening around my hip, it's a really good thing to note. Now, let's just stand up and see what's happening with that hip in standing as well. So now I'm going against gravity, so it's going to be a lot harder, right? Essentially, I really want to just see, can I get my knee past or my front of the leg right here, the top of the leg, past horizontal. So from here, can I go up about as high as I could? Clearly, I'm further from when I was on my back, right? So gravity kind of helps me on that back, and I might have tucked in my tailbone a little bit. So you see that compensation that could pull from my low back. So if I were to just keep my back straight here, my ribs down, my hip down. So this is where you want to be. You can hang on to something too if you need to. Can I keep that hip in place? And then can I get my knee higher than horizontal? So if you're lacking, it could be some tightness in the back of the leg. It could be some strength deficits right in the front. Even though we always talk about, releasing the pressure in that hip flexor, we also want that hip flexor to be really strong. It's what's going to help guide us down into that squat. It's going to give us that full range of motion. It's going to make our body nice and strong. Again, so that the back and that lower SI sacroiliac area doesn't take on so much pressure. Let's test the other side. So keeping that hip down, can I get that leg above horizontal? And then can I pull it as high as possible? Again, any pinching, aching, if you can't even hold it there for very long, a really good test to see, okay, maybe I have some strength deficits happening. Now let's lie back on the floor, and we're going to do a different test than you might be used to for this hip extension. So typically I would be on my stomach and just lift my leg, but sometimes it's really easy to get into that low back. So instead, I'm going to do a bridge, but with a single leg. And we're going to do 2 tests here. So if this is too difficult to get into this particular test, you can wait. I'm going to have a different one. Okay. So bring the knee in toward your chest, laying on this back, and you're going to try to lift into a bridge position as high as possible. This is where having a phone is really helpful again, So I'm going to push and keeping this knee in as much as possible. How high can I get? So if I can only come up to here because I can't quite get there, then I know that I have maybe some limitation in this hip extension. If in order to get there, I have to allow my knee to pop out, well, then I'm still have some compensations happening in my back. So really good area to see, maybe not only do I need to work on my hamstring and glute strength, but I might also need to make sure I'm not compensating through my low back or through my quad. So this is a really good test for hip extension. Let's try the other side. Again, grabbing this leg. I'm going to try to go as high as possible, reach. And I feel like I'm a little bit more restricted. It's a little harder to get into that full range of motion on this side. So again, that could be a joint issue. That could be a strength issue. You get to see and really start to know your body better when you do, and you go through the full programs that I have located below, because I have hip programs, low back programs, so much that will really help you to understand, is it joint restriction? Is it a strength deficit? So we go through that more throughout the program as you get to know your body. Last test we're going to do for that hip extension is coming actually into a quadruped position, but on your elbows. So from here, while I like doing it on the elbows, and again, you can do this in bed if it's too difficult to kind of get down to the floor right now. But what I like doing it on the elbows, because on the hands, but a lot of people do with extension, is they actually get into the low back. And so it's cheating, like, oh, I can get my leg above horizontal. Well, is that pure hip range of motion though? So when I come here, I kind of lock out that spine a little bit more, and I want to think of pushing the ground away. So I want to think of pushing that chest away. And now with a bent leg, how high can I get? And this is where, with that video that you might have rolling, you're going to look from that knee. Can you get that top leg parallel to the floor? Okay. Test the other side. Or maybe you're in front of a mirror, so you can look right in front of a mirror. And then again, see, can I get that leg parallel? Push against the floor. And that's going to make sure that your low back isn't compensating and cheating. And so you really get to see that hip range of motion. Again, hip restrictions in this area could be due to a lack of like space within that joint. So it's not moving well that way. And when we start to improve that joint space based on some of the exercises that I have in the programs, you're going to notice a lot more opening in being able to squat deeper, get out of that low back, actually be able to find that glutes and find those hamstrings and fire them up without feeling like they're not awake. You know, a lot of people complain of glute amnesia. Well, it's usually just a hip restriction problem, and we're not quite getting into those hips yet to open up that range of motion in order to then improve the strength. So we want to always start at this foundation. How are the hips moving? If they're not moving very well, could it be a hip restriction or could it be a strength deficit? Maybe it's a little bit of both. And we really dive into the programs to understand mobility, to understand strength, and to understand how to fire and connect this brain to the muscles so that everything starts to feel more open. Take pressure off of that low back, take pressure off of those knees. Okay. This is why getting this access point, our hips, is where we want to move from primarily. So we're not putting so much tension into the back and the knees. So check out the programs below so that you can start to open up your access point, start to open up your movement, and hopefully feel better. Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.